Welcome to Oral Anatomy. Today we will review the permanent mandibular molars. The permanent mandibular molars are the 6th, 7th, and 8th tooth from the dental midline. Using universal annotation, they are numbered numbers 17, 18, and 19 on the left side, and on the right side, they are numbers 30, 31, and 32. Using international annotation, where the teeth are numbered according to quadrants, and then the tooth from the midline, the mandibular left molars are numbers 3-6, 3-7, and 3-8, while the mandibular right molars are numbers 4-6, 4-7, and 4-8. There's some dental jargon associated with annotation, with the molars being the 6th, 7th, and 8th tooth from the midline. The 6s refer collectively to the first molars. These are also called 6-year molars because they erupt in children around the age of 6. The 7s refer collectively to the second molars. These are also called 12-year molars because they erupt in children around the age of 12. And the 8s refer collectively to the third molars, also called wisdom teeth. They are also called the 18-year molars because they erupt later in life when more mature and have gained that wisdom. This is an overview of mandibular molar class traits. The mandibular molars have 4 major cusps. The first and third molars also have a 5th cusp called the distal cusp. The mesial buccal cusp is the largest cusp, followed by the mesial lingual, distal buccal, distal lingual, and then the distal cusp on the first and third molars. The distal cusp is the smallest and is offset to the buccal side. This is a summary of mandibular molar type traits, comparing from first to second to third molars. All third molars have a distinct multi-cusp structure with a prominent buccal and lingual cusps. Each molar has 2 roots, although the size and inclination vary among them. Each molar has developmental grooves that separate the cusps, although the patterns will differ. Continuing on with the comparisons, all molars have a rhomboid geometric outline from the mesial aspect, with the occlusal portion shifting lingually. Each molar has a facial crest of convexity in the cervical 1/3 and a lingual crest of convexity in the occlusal portion of the middle third. Each molar has a prominent mesial marginal ridge. For some more comparisons, from the occlusal aspect of the molars, there is a more facial surface visible compared to the lingual surface. The central developmental groove is located lingual to the facial lingual center of the tooth. The occlusal table is shifted lingually, and the buccal cusp ridges are lingual to the facial outline of the tooth. All molars have well-separated lingual cusps that exhibit internal cusp ridge concavities. The crowns of all molars taper lingually, allowing for visibility of some mesial and distal surfaces. And all molars have a root bifurcation that is apical to the cervical line, but varies in position. Some more of the type traits include that from the distal aspect, all molars allow for greater visibility of the occlusal surface compared to the mesial aspect due to the shorter distal crown profiles. All molars possess a distal root that is narrower buccolingually compared to the mesial root. This is a summary of mandibular molar functions. The primary function being mastication, or grinding the tooth into tiny pieces. Molars have a broad and complex occlusal table to facilitate this grinding. They're also included in the aesthetics. They can enhance the appearance, although this is limited, but you will find some patients find that the aesthetics of the mandibular molar is very important to them, and you will have to align with that. For phonetics, they can aid in the pronunciation of certain sounds, although this is more limited than you'll find with anterior teeth. And molars are a cornerstone in the development of the occlusion and help set that vertical dimension of occlusion of the jaw position. Now let's look more closely at each of the molars, starting with the mandibular first molar. The development of the mandibular first molar begins with the initiation of calcification at birth. The crown will complete its formation around the ages of 2.5 to 3 years. It will erupt into the mouth between the ages of 6 and 7 years and complete its root formation between the ages of 9 and 10 years. Its average dimensions include an overall length of 21 millimeters, a crown height of 7.7 millimeters, a mesial distal diameter of the crown of 11.2 millimeters, a facial lingual diameter of the crown of 10.3 millimeters, and the curvature of the cervical line is 1 millimeter on the mesial and 0 on the distal. From the facial aspect, the mesial buccal and distal buccal cusps are flat and strong and will make up about 80% of that mesial distal diameter of the tooth. The shorter distal cusp is more conical and occupies the remaining 20% of that mesial distal diameter of the tooth. The lingual cusp tips will project above the buccal tips when viewed from the facial. The mesial crest of convexity is at the junction of the middle and occlusal 1/3 of the crown. The mesial profile from the crest to the cervical line is relatively straight. The distal crest of convexity is in the middle 1/3 of the crown. The broadly convex distal cusp will overhang the root trunk. Here you can see the blue line in tangent with the root trunk, and the distal cusp is overhanging that line. The mesial buccal developmental groove terminates in the buccal pit centrally located occlusal cervically, and this buccal pit is commonly involved with a carious lesion. Typically, you'll see in people, if the occlusal groove or central groove is decayed, often this buccal pit can be decayed along with it. It's also an area that should be sealed. If you're doing sealants on the occlusal surface of the tooth, you should seal the buccal groove and buccal pit with it. The distal buccal development groove separates the distal buccal cusp and fades into the cervical 1/3 of the crown. So with this distal buccal groove, you won't see the same kind of pit that you'll see with the mesial buccal groove. This one just kind of fades out. So you're not often going to see caries on that surface of the tooth unless there's more extensive caries overall on the tooth. The cervical line is convex apically, and it may have an incipient enamel extension. Right here, it may dip a little bit on that cervical line. The root trunk bifurcates approximately 3 millimeters apical to the cervical line. The mesial root profile is a concave convex extension of the crown profile, rounding to an apex directly below the mesial buccal cusp. All right, so you see here the mesial profile extends onto the root, is a little bit concave right here, then goes convex again, and then rounds to an apex directly below that mesial buccal cusp. The distal root extends in a distal direction with a more pointed apex than you'll see on the mesial root. Now, looking at the mandibular first molar from the mesial aspect, the geometric outline of the crown is rhomboidal, with the occlusal portion of the crown shifting lingually. The blunt mesial buccal cusp is more centrally placed facial lingually than the longer and sharper mesial lingual cusp. So if this green line is the center of the tooth facial lingually, you can see that the mesial buccal cusp is closer to it than the mesial lingual cusp. The facial cresta convexity, or the buccal cervical ridge, is in the cervical 1/3 of the crown. The facial crown profile from crest to cusp tip is relatively flat. The lingual cresta convexity is in the occlusal portion of the middle third of the crown. The lingual crown profile is smooth and spheroidal and flattens near the cervical line, right here. The mesial marginal ridge is strong. A marginal ridge groove typically crosses the mesial marginal ridge, lingual to the buccal lingual center of the crown. Again, here is your strong mesial marginal ridge, and you have a marginal ridge groove right here crossing the mesial marginal ridge, and it's lingual to this buccal lingual center of the crown. The cervical line of the lingual half is occlusal to the buccal cervical line. The broad mesial root has a longitudinal concavity that extends to the middle third of the crown. The buccal border of the mesial root drops straight to its middle 1/3, and then it curves lingually to meet the buccally inclined lingual border at a broad, blunted apex. Now, looking at the mandibular first molar from the occlusal aspect, the general geometric outline is pentagonal, with two of those planes being on the buccal surface. So this pentagon is one with equal sides and equal angles that I've drawn there. However, if you want to draw it a little more accurately to the mandibular first molar, it's not really equal in lengths and angles, but this is where the 5 sides would align for this geometric outline. And the blue line being the outer surfaces of the molar versus the blue outline, or the yellow outline being along the cusp ridges and the marginal ridges. So either way, it has a pentagonal shape to it. The proximal surfaces are relatively flat and they will taper lingually. From the occlusal view, more of the facial surface is visible than the lingual surface. So here, again, you can see quite a bit of the facial surface because the cusp ridges of the mesial buccal and mesial lingual and distal cusps being a little bit more centrally located than the mesiolingual and distal-lingual cusps being farther out to the lingual. So very little of the lingual surface can be visible from the occlusal view. The central developmental groove is lingual to the facial lingual center of the tooth. So again, here you can see the center of the tooth, but if you look at the central groove, it's offset to the lingual of that. And here you have your central pit, your mesial pit, and your distal pit. The lingual cusp ridges are near the lingual outline of the tooth. As we noted a few slides ago, very close to the lingual outline of the tooth. The buccal cusp ridges are lingual to the facial outline of the tooth. The triangular ridges of the lingual cusps are longer than the triangular ridges of the mesial buccal and distal buccal cusps. Okay, again, noting that the buccal cusp ridges are more centrally located, shortening the distance from the cusp ridge to the developmental groove, versus on the lingual side, the triangular ridges are going to be longer and a farther reach to get to the cusp ridge of the mesiolingual and mesial and distal lingual cusps. There are 4 developmental grooves that radiate from the central pit that divide the tooth into 5 cusps. Again, the 5 cusps being the mesial buccal, the distal buccal, the distal, the mesiolingual, and the distal lingual. And we'll look at each of those grooves in more detail. Starting with the mesial buccal groove, this separates the mesial buccal cusp from the distal buccal cusps, and it terminates in the buccal pit here, just occlusal to the buccal cervical ridge. Okay, so again, starting with the central pit, it travels up and separates the mesial buccal and distal buccal cusps, terminating in this buccal pit. The distal buccal groove separates the distal buccal cusp and the distal cusp. So here, starting from the central pit, travels up here, dividing the distal buccal and distal cusps. And then this is a groove that fades onto the distal facial surface. The lingual groove separates the mesial lingual cusp from the distal lingual cusp. Again, starting from the central pit and dividing the 2 lingual cusps. The combination of the mesial buccal, distal buccal, and lingual developmental grooves creates a Y in the center of the occlusal surface. The mandibular second premolar and the mandibular first molar both have this Y groove pattern on the occlusal surface. The central groove is the 4th developmental groove that radiates from the central pit, and it overlaps with the mesial buccal groove and the distal buccal groove for part of its travel. All right, so this one travels from mesial to distal with some overlap of the other grooves, but that is your central groove of the mandibular first molar. Now looking at the mandibular first molar from the lingual aspect, the long lingual cusps are well separated with internal cusp ridge concavities. And this is something that you're going to need to note when you do the waxing practical for this tooth, is that these lingual cusps are well separated, and then there's going to be this internal cusp ridge concavity that you have to create along that cusp ridge on both mesiolingual and distal lingual internal cusp ridges. The lingual cusp ridges make a 100-degree angle at their cusp tips, so a little bit more of an obtuse angle compared to the other cusp ridges. The mesial lingual cusp is slightly longer and wider than the distal lingual cusp. Some mesial and distal surface is visible because the crown tapers lingually. Okay, so you'll see some of the mesial surface and some of the distal surface from this lingual view because of the tapering of the tooth towards the lingual. The cervical line is variable with its apical convexity. And the root bifurcation begins approximately 4 millimeters apical to the cervical line. From the distal aspect, more of the occlusal surface is visible from the distal aspect than the mesial aspect because the crown is shorter on the distal. This is something to note as you're doing your annotation practicing, is to look at the tooth from the lingual and see which marginal ridge is more occlusal and which marginal ridge is more cervical. The marginal ridge that is more cervically positioned will be the distal marginal ridge. The distal cusp is buccal of the center buccolingually. All right, here you can see the smallest fifth cusp here, buccal of the center. The cervical line on the distal is nearly horizontal from lingual to buccal. And here's a comparison to the mesial where you'll see about 1 millimeter of a flexion of that cervical line. The distal root is narrower than the buccolingual root, narrower buccolingually than the mesial root, with no or sometimes shallow longitudinal depression, and it tapers to a sharper apex. Okay, so the red here is the outline of the distal root, which is narrower buccolingually than the mesial root. And here you can see a hint of the mesial root to the outer edges. Now we will look at the permanent mandibular second molar in more detail. The permanent mandibular second molar begins its development with the initiation of calcification at the ages of 2.5 to 3 years. The crown will complete its formation between the ages of 7 and 8. It will erupt into the mouth between the ages of 11 and 13 years, typically at 12 years. The root will complete its formation between the ages of 14 and 15 years. For average dimensions, the overall length of the second molar is 19.8 millimeters. It has a crown height of 6.9 millimeters, a mesial distal diameter of the crown of 10.7 millimeters, a facial lingual diameter of the crown being 10.1 millimeters, and the curvature of the cervical line is about 1 millimeter on the mesial and 0 millimeters or flat on the distal. From the facial aspect, the blunt mesial buccal and distal buccal cusps of equal size are separated by the buccal developmental groove. The longer and sharper mesial lingual and distal lingual cusps are visible in the background. So here from the facial view, again, your mesial buccal cusp being a little bit blunter and shorter than its mesial lingual cusp in behind it. The mesial contact is a uniform convexity occlusally placed in the middle third of the crown. The distal contact is a uniform convexity in the middle of the crown. The mesial and distal crown profiles of the mandibular second molar show less cervical tapering than the first molar. So here you can see the distance between the cervical line and the crest is a little bit less than the first molar, where you'll see that tapering is a little bit more exaggerated. The mesial and distal roots diverge less and incline distally more than those of a mandibular first molar. So again, a few more subtle changes where the roots diverge a little bit less. So you can see the distance here between them. It's a little bit closer than on the first molar. And they're inclined distally more. Okay, so off the long axis here, a little bit more of an angle than the first molar. From the mesial aspect, the geometric outline of the crown is rhomboidal. The occlusal portion of the crown shifts lingually. This is a pattern you'll see on other posterior teeth. The facial crested convexity is in the cervical 1/3, but it is less pronounced cervical ridge than that of the mandibular first molar. The facial profile of the second molar from crest to cusp tip is more convex than the facial profile of the first molar, and it is superimposed on the distal buccal cusp, which is visible in the background. Okay, so that's different from the second molar and the first, is that in the second molar you can see a hint of the distal buccal cusp from the mesial. The lingual crested convexity is in the occlusal portion of the middle third of the crown. The lingual profile is convex from cusp tip to just above the cervical line where it flattens. The mesial marginal ridge is prominent on the second molar, similar to the first molar, also has a prominent mesial marginal ridge. And here the cervical line has almost no curvature, a little bit of a wave to it. The mesial root tapers continuously from the cervical line to a pointed apex, occasionally revealing part of the distal root. Okay, so here's a little hint of the distal root here and a little bit up here. Otherwise, you can see the continuous tapering of that mesial root. From the occlusal aspect, the geometric outline is basically a rectangle with a rounded distal profile. Okay, so the mesial profile a little bit straighter, and the distal profile a little bit more of a rounded edges to it. The proximal surfaces of the mandibular second molar have less lingual taper than the mandibular first molar. They both taper lingually, but the second molar a little bit less taper than the first. Also, from the occlusal aspect, there's more facial surface visible than the lingual surface. Here with the yellow rounded rectangle following the cusp ridges and the marginal ridges. And here seeing a fair amount of the facial surface visible and less of the lingual surface. That follows the same pattern as the first molar. The central developmental groove is lingual to the facial lingual center of the tooth. Here also, you can see the central pit, mesial pit, and distal pit, all offset to the lingual. The occlusal table is shifted lingually on the tooth. The buccal and lingual developmental grooves meet with the central development groove at right angles, dividing the occlusal surface into 4 nearly equal cusps. So when you're looking at second molars, you'll see this more of a cross shape or a T shape with the outline of the developmental grooves compared to the first molar that had a Y pattern. The widest facial lingual diameter is in the mesial moiety. Here, the red line measuring that out for you. You can see it's widest through the mesial buccal, mesial lingual cusps, and a bit narrower on the distal half of the tooth. The cusp ridges of the distal buccal cusp lie buccal to the cusp ridges of the mesial buccal cusp. Okay, so you can see that these are just slightly more buccal than the mesial buccal cusp ridge. The supplementary grooves radiate from the developmental grooves, giving the occlusal surface a wrinkled appearance. From the lingual aspect, the long lingual cusps are well separated with internal cusp ridge concavities, following the same pattern as the mandibular first molar, with these internal cusp ridge concavities on the mesiolingual and the distal lingual internal cusp ridges. There's little proximal surface visible because of the slight lingual taper of the crown. Again, less lingual taper than the mandibular first molar, so less visibility of the proximal surfaces from the lingual view. The mesial distal diameter at the cervix is as wide lingually as buccally, making for a stocky looking crown. The triangular ridges of all 4 cusps are visible from the distal aspect because the crown is shorter distally than mesially. So again, something to look for with your annotations is this more cervical position of the distal cusp ridge and being able to see the triangular ridges of all 4 cusps from this aspect. The distal buccal cusp tip is facial of the mesial buccal cusp tip. The facial profile of the distal buccal cusp is a gentle curve cervically with no cervical ridge in evidence. The cervical ridge is seen, however, with the mesial buccal cusp. We will now look at the permanent mandibular third molar in more detail. The development of the mandibular third molar begins with the initiation of calcification between the ages of 8 and 10 years. The crown will complete its formation between the ages of 12 and 16 years. It erupts into the oral cavity between the ages of 17 and 21 years, and the root will complete its formation between the ages of 18 and 25 years. The average dimensions of the mandibular third molar include its overall length being 18.5 millimeters. It has a crown height of 6.7 millimeters, a mesial distal diameter of the crown of 10.7 millimeters, a facial lingual diameter of the crown being 9.8 millimeters, has a curvature of the cervical line being 1 millimeter on the mesial and essentially 0 on the distal. Note that the mandibular third molar is often anomalous, but two distinct types seem to predominate, those with a 5-cusp arrangement like the first molar, so like a miniature version of the first molar, and those that resemble a second molar with a small distally placed 5th cusp. The drawings we're going to review here are of the former type, the one that matches the mandibular first molar, but is a little bit more miniature and rounded version of it. Beginning with the facial aspect, the proximal cresta convexity are centrally located, giving the crown a bulbous appearance. The lingual cusps are longer than the buccal cusps, but are not as well separated as those with the first molar. The mesial buccal groove separates the mesial buccal and distal buccal cusps and terminates in a buccal pit. There is no definite ridge cervical to it as it is present on the first molar. Okay, so the permanent first molar, again, you'll see a buccal pit similarly, but the cervical ridge here is more prominent. On the third molar, it's not as definite, a little bit more of a rounded profile. The distal buccal groove separates the nearly equal-sized distal buccal cusp and distal cusp. The two roots of the third molar are shorter and exhibit a more definite distal inclination than do the roots of a first molar. The furcation of the root trunk moves apically from first to second to third molar, and the third molar has the shortest roots and the longest root trunk. From the mesial aspect, the buccal crest of convexity, a gentle curve, approaches the middle 1/3 of the crown. The intercuspal space is narrow. The round lingual crest of convexity is in the middle 1/3 of the crown. The combination of the first three factors from the mesial aspect gives the crown a bulbous appearance from this view. Compared to a first molar, the third molar mesial root is shorter, less broad, and has a tapered, unpredictable profile. From the occlusal aspect, the geometric outline is a rounded version of the pentagonal outline of the first molar. Here I've drawn the pentagonal shapes again. Not able to draw it with rounded corners, but you will have to envision that this tooth is a little bit more rounded and not as sharp with its line angles. More of every axial surface is visible compared to the first and second molars because of the narrowed and small occlusal table. The cusp ridges of the third molar becoming closer to each other, revealing more of the axial surfaces and narrowing up that occlusal table. The major developmental grooves have the same general pattern as the mandibular first molar. The cusps have less definite triangular ridges, and there are more supplemental grooves and ridges present. The distal cusp is lingual to and nearly the same dimension mesial distally as the distal buccal cusp. From the lingual aspect, the lingual cusp tips of the third molar are not as widely separated as those of a first molar. The lingual furcation is very apically located, leaving a very long root trunk. From the distal aspect, because of the buccal lingual tapering towards the distal, the axial profiles of all cusps are visible. The distal root is narrow and shorter than the mesial root. If we look at a summary of the mandibular molar facial and lingual geometry, all molars are trapezoidal from the facial and the lingual aspect. Now, if we look at the proximal geometry, all molars are trapezoidal from the mesial and distal aspect. And from the occlusal aspect, the occlusal geometry, we have a pentagon with the first molar, a rectangle, but with a rounded distal corners on the second molar. And then the third molar is a rounded pentagon shape. This table is a summary of the maxillary and mandibular molars and their development from the initiation of calcification, the crown completion, the eruption, and the root completion. And this table summarizes maxillary mandibular molars, their average dimensions, including their length overall, their crown height, their mesial distal diameter of the crown, and the facial lingual diameter of the crown. Noting a few of the distinctions here, the maxillary and mandibular first molars have the tallest crown height. The maxillary first molar is the widest facial lingually diameter of the crown. The mandibular first molar is the longest overall. And the mandibular first molar is the widest mesial distally diameter of the crown. And the maxillary third molar is the smallest in all dimensions except the facial lingual diameter of the crown is the smallest with the mandibular third molar. And thank you for your kind attention today.